Hello everybody, welcome back to our virtual classroom. Today we are going to be talking about welfare reform and the feminization of poverty. In the welfare reform, we're going to be talking about how the AFDC transitioned to TANF, the welfare to work concept, the PWRWORA, and child support enforcement. So we're going to start by conceptualizing the feminization of poverty. What does that phrase actually mean? So women went on welfare because they were expected to remain at home to care for their young children when their husbands were unable to support them due to death, disability, unemployment, or were unwilling to support themselves and their families. As a result, women were forced into low-paying jobs because they had no skills, they had no education, and women have always been paid less than men for the same work. This is nothing new. Women have always tended to be the overwhelming majority of welfare recipients. However, we really became aware of that trend in the 70s and 80s as the number of female-headed households increased. One of the main issues is that women have to pay for childcare in order to work. Any of you who are parents know that the cost of childcare is absolutely astronomical. So think about what we're seeing right now with the pandemic. Who is primarily responsible for childcare? Mothers, women. Schools and daycares are all closed. Women have to stay home to care for children. If they are not salaried employees in a job that allows them to work from home, they have to use all of their paid time off and to try to stay home with their kids right now. Many women work low-wage jobs and don't have paid time off. The majority of restaurant workers are women. So right now we have a very large segment of women who are unemployed during the pandemic. Their unemployment benefits, which as of now are 2/3 of their average wages, will not be enough to support themselves. If the unemployment benefits time limit is not extended, at the end of 26 weeks, we'll see large increases in the number of women applying for welfare, or TANF, which we're going to talk about. So all of these factors together have contributed to a pattern in which women are much more likely to be poor and more likely to have to receive public assistance. So I just want to take a moment to separate public assistance from social insurance, which you learned about in the last lesson. Public assistance programs are means tested, meaning that they are based on a threshold of income. They tend to be much less generous with payments. They're geared towards women and children, whereas social insurance programs are more generous and geared towards male workers. These programs have not kept pace with the changing roles of men and women. Women are overrepresented in SSI, which is supplemental income for people who are impoverished. 58% of SSI recipients are women. 71% of elderly people requiring SSI to supplement their Social Security are also women. And that's because Social Security benefits tend to be lower than men's. They're less likely to have other sources of income other than pension, and women live longer than men. So women have to live with less income. There are gender inequalities, as we mentioned, in Social Security. Women are paid less, they have less time in the paid workforce. Divorce, widows, homemakers. Benefits are based on the primary worker, and you have to be, in most cases, married to them in order to get any benefit from that. So now let's talk for 1 second about the history of welfare. So ADC, which was aid to dependent children, grew slowly. There were some minor changes between 1935 and 1950. If there were an able-bodied, unemployed father in the house, the family was not eligible for a penny from ADC. So if you had an unemployed, able-bodied father who could not find work for whatever reason, even if it wasn't any fault of his own, the family could not get this aid, and the father could not support his family. However, if the man deserted the family, they could become eligible for ADC assistance. So during that time, a lot of men actually left their families so that their families could get government aid. In 1961, the ADC unemployed parent was enacted. The anti-recession measure made it possible for children to receive aid because a parent was unemployed. In 1962, the program name changed to AFDC, Aid to Families with Dependent Children, to emphasize the family unit. In states with the AFDC UP program, a second adult was considered eligible. If one parent was incarcerated, the child got benefits. 1967, AFDC unemployed was changed to AFDC unemployed father program. But in 1979, it was ruled unconstitutional as it provided benefits to unemployed fathers, but not to unemployed mothers. Changed it back to AFDC UP, but some states didn't participate. In 1988, the Family Support Act required all states to have an AFDC UP program. Few folks were on the rolls. There were very strict eligibility requirements, and it heavily favored parents who were recently unemployed while excluding the long-term unemployed. So we're going to talk for a moment about the myths of TANF. So if you look at the cartoon on slide number 5 of the PowerPoint, this cartoon came out in the 1980s during the Reagan administration. And it was during the Reagan administration that they coined the term welfare queen. And you notice it's a queen, a woman. You never hear of the welfare king. So if you look at the cartoon, you'll see that she's a welfare queen buying a Cadillac with all of her money because the Democrats are in power. So you notice that this paints welfare as something that is abused, something that is a democratic concept, and the fact that the welfare queen is a black woman. So the perception is that too many people are on welfare. At its peak in 1994, there were 14.2 million folks receiving benefits. That was only 5.5% of the US population. At its peak in 1994, AFDC was less than 1% of all federal, state, and local expenditures. And while program costs rise, the purchasing power of the money that came from it decreased by 51%. So as of now, less than a quarter of all families living below the poverty line collect TANF. That's temporary assistance to needy families. And it's not who you might think it is. Again, most of the time, it's painted that primarily black folks are the ones that are using the welfare system. However, 43.3% of recipients of TANF are white, 30.3% are black, and 26.4% are Hispanic Latino. So if you click on that cartoon, you'll be able to see an article that talks more about this. So then, let's talk about the myth of welfare causing the demise of the American family. Studies showed that the AFDC was not associated with increased marital stability. There was no support for higher payments being a destabilizer. The impact of welfare on the family structure was very modest. Welfare, it's been shown, has a minimal effect on family structure. Changes in family dynamics and family composition occurred amongst all segments of the population, in which it's a much more reasonable explanation for the composition of families receiving AFDC. So despite the evidence, the myth that welfare is responsible for family demise persists so much that an explicit, remember we talked about explicit versus implicit goals of policy, an explicit goal of the 1996 Welfare Reform Act under Clinton was to end welfare dependency by encouraging marriage. So that painted welfare as something that's only used by single mothers. That led to man-in-the-house rules. Even if public assistance is not the root cause of family instability, the number of able-bodied parents who receive benefits continues to fuel debate in a public that's concerned about the morality of receiving welfare. The work ethic suggests that people capable of self-support should not be entitled to any public aid. So the thought of welfare mothers allowing able-bodied men to spend time in their homes presented a threat to people who wanted to ensure payments went only to what they considered the right people. It was considered immoral and illegal for the mother to allow anyone else to benefit from their welfare check. So if you were a single mother receiving welfare, you had to prove basically that you had no stable man in your life. So you couldn't have, say, a partner that was living with you part-time. That would disqualify you from receiving welfare. Sometimes there were even midnight raids and home visits late at night. Most states no longer do this. I say most. Instead, they use electronic checks of state and federal records to monitor compliance. Believe it or not, one state that still sometimes does those home visits is California, of all states. So then changes began with Reagan, who wanted to determine welfare needs more accurately. He wanted to improve program administration and make it more efficient. He wanted to reduce fraud and abuse, and he wanted to decrease federal and state costs. So in doing that, he removed about 500,000 families from the welfare rolls. Researchers suggest that children were plunged deeper into poverty as a result of George H.W. Bush. More into poverty as a result. George H.W. Bush then encouraged more state innovation with AFDC, not necessarily funding for AFDC, but innovation about how to use the funds. Bill Clinton wanted to end welfare as we know it. He wanted to make work pay. It was during Bill Clinton that we saw the welfare to workfare movement. So he wanted to increase incentives to self-sufficiently through education and training. He raised the earned income credit, which we've talked about in class, and he wanted to provide seamless childcare and healthcare. So he instituted the Personal Responsibility and Work Opportunity Reconciliation Act of 1996, which ended AFDC and began TANF as a new program. That shifted income support to a system that emphasized economic self-sufficiency through employment. It was composed of 2 block grants from the federal government to the states. So family assistance block grants were used to provide cash to families, help families go to work, and avert out-of-wedlock pregnancies. It also encouraged parents to establish or maintain 2-parent families by combining AFDC and the jobs programs. The second piece was that it gave childcare to help families leave the public assistance roles or avoid receiving public assistance in the first place without being worried about, who's taking care of their children. Something we could really use now. So the guidelines of TANF were that you could get cash assistance for no more than 5 total years. So that's 5 years over your lifetime. States may exempt up to 20% of caseloads from this limit under extenuating circumstances. Federal funds cannot be used to pay TANF benefits to most immigrants during their first 5 years in the country. So all of those myths that the undocumented immigrants are taking all of the welfare benefits, they don't qualify for any of them. States may exclude immigrants who have not become citizens after 5 years but do have a legal presence. You may grant other exemptions for disability or for cases of domestic violence. However, recipients must start to work no later than 2 years after they start receiving benefits. Any single parents not participating in job skills or education programs are required to put in 30 hours a week at work-related activities. Single parents with kids under the age of 6 are held to 20 hours. Those who fail to work all the hours will be deducted a portion of the benefits. Now, I want to take a moment to talk about this because it has been shown that the best thing to get people out of poverty is higher education. However, higher education, single mothers going to college, is not considered a work activity under this policy. So in order to get a college education that would help bring them out of poverty, they would have to work the hours required by TANF, but additionally go to school. So, let's see, to discourage out-of-wedlock births, states may eliminate all cash payments to unmarried teen parents. Any states that offer payments must require the teen live with an adult and attend school. Drug offenders can be barred from TANF forever, but their kids can get benefits. States may contract the services out to religious and private organizations, and states may use the TANF money to create developmental savings accounts for beneficiaries. So if you look on slide 9, you can click on the map to see the size of the caseload per state. It is a 4-year-old document, but it's a really good resource that you're going to need for exam 4. The numbers haven't changed that much. We don't know yet if the states and federal government intend on changing anything in response to the current pandemic. Again, slide 10, click on the map for the requirements. It'll be another great resource for exam number 4. So the greatest gains have been establishing paternity from 676,000 in 1994 to 1.6 million established paternity cases today. The number of parents with child support orders established increased from 70% in 2002 to 83% in 2013. However, only about 70% of these cases are actually able to collect the money owed. About $12.3 billion in child support went uncollected for a number of reasons. The poorest mothers have had far better outcomes than non-poor mothers. However, some critics of child support enforcement complain that too many mothers don't have awards, too many awards are not collected, and the size of child support is often too small. When you think about cost effectiveness of the program, how do you calculate cost effectiveness? If you're only looking at the administrative costs, then it's effective. Click on the link in the slide, and this is slide number 11 for more information on that. So how effective has TANF been in reducing poverty? The problems that led families to welfare remain as barriers to work for TANF recipients. Those are healthcare problems, lack of education and skills, mental illness, substance abuse, disabilities, childcare, transportation issues. And the more problems people face, the less likely they are to work. And those with the most severe problems and the most rigid barriers to working were often had to leave welfare voluntarily due to sanctions that they could not fulfill. So we are going to end this on slide number 13. Take a look at the chart. This is a breakdown of a number of social insurance and welfare policies. Take a look, see how they're funded, who's eligible for them, and what type of programs they are. This will be a really good resource for your coming up exams. Hope you're having as good a week as you can. See you next time. Bye.